The County of San Bernardino is here to serve you during COVID-19. Go to sbcovid19.com to find important resources during this crisis. Find a testing location near you. Learn the latest on what businesses are closed or reopening. Find food assistance. Get foreclosure and evictions help. Connect with business recovery assistance. Or sign up for a daily email update. Let's work together to keep us all safe and healthy. Go to sbcovid19.com for more information.
Good morning, everybody. My name is Kurt Hagman. I'm the chairman of the Board of Supervisors of San Bernardino County, and I want to welcome you to our weekly update of where we're at. I'm joined by a number of dignitaries here from the county, including my vice chair, Josie Gonzalez, and Trudy Raimondo, our director of public health, and our doctors from ARC, as well as the sheriff's department and district attorney's office to answer any questions you may have later. Today, our update is going to be where we're at so far today, and what our plans for our businesses and our residents in the weeks coming forward. We first would like to offer our condolences for the 93 lives we've lost in this county, as well as the many others throughout California and the rest of the nation. At this time, there's no doubt that this continues to be a hard time for our residents, especially our businesses and those who have lost their jobs, and we want to do everything in our part as a county to get them back on their feet. We're making progress on that. As you know, last weekend we opened up our passive open spaces to let our public start to use the great outdoors that we have here in San Bernardino County. And we saw our residents do a good job. They kept their social distance, they kept their mask on, and as well as used their hygiene well. And so we kept people safe while they start to enjoy this great summer weather we're having. And we look forward to them continuing to do that. I actually heard a couple of good fish stories already from Prado Park that they had a couple big fish caught out there, so it's great to see that. And we hope that continues in the weeks ahead of time, doing so safely. As we continue to see hot weather coming forward, we'll be looking at modifying our county public health order to see what other recreation activities we can do in a safe manner, as well as what, through the guidance of the governor's office, what other businesses we can start to open here in the near future. So we have working very hard on the plans coming forward, but before we get into those plans, I'd like to introduce Trudy Raimondo, the head of Director of Public Health, to see where we're at this point. And good morning, Trudy.
Good morning, everybody, and thank you again for being here. I'm going to flip through these slides. So, as you heard last week, I unveiled our beautiful new expanded dashboard. Hopefully, all of you have had an opportunity to take a look at it. As the chair had indicated, unfortunately, as of today, we have over 2,000 confirmed cases and 93 associated deaths. As many of you are aware, the governor, through his pandemic resilience roadmap, has established a framework for really kind of understanding the readiness of California as it moves from phase 1 to phase 2. So what I wanted to be able to highlight to you today is a couple of metrics that we've started to put on our dashboard that really are going to be important for us at the local level as we start to look at whether or not San Bernardino County is ready to move in the same direction. So again, this is the one that shows the total number of confirmed cases as well as the doubling time. At the very bottom, you will see where we have kind of started to put a trend line around the confirmed cases per day. And that really is an averaging, and that's a line that we're going to pay very close attention to as we start to move into the next couple of weeks. What's more important is on our testing tab, one of the things that we are going to be doing in the next couple of weeks is really ramping up all of our community testing efforts. We know there is still a huge gap in a lot of the testing that we need to be doing. Testing is one of those metrics that the governor is looking at. So we'll be going through that process the next couple of weeks. What I want to be clear, though, is that as we increase testing, we know we're going to see an increase in positive cases. That's simply to be expected. But what I want to point out on our testing tab is down at the left-hand corner, this idea of total confirmed patients. That is our positive rate. That's the rate we're going to pay very close attention to, because what we want to happen is that for that number to not increase, hopefully stabilize, and ultimately, hopefully decrease as well. With some of the earlier slides that I want to be able to go back to, these are also some of the things that we want to be able to pay close attention to. So what you see here is actually a representation of increases, percentage increases that we have been seeing and mapping from April 1st all the way through April 29th. And as you can see, we saw some remarkable percentage increases in our new cases. Thankfully, what we have started to see, because of all of our aggressive efforts with the face coverings and the social distancing and all of those things we're putting into place, as you can see, that line has come down dramatically over the last 30 days. And that's what we continue to want to see. As we start to move into recovery, what we don't want to see is a sudden increase in some of those percentage numbers. And again, this average new cases per day, what we want to see, because granted, you will see an increase in the number of positives as we increase testing, and that's why we want to look at averages. And so what we want to see is that average number stay flat. That's what we're saying is flattening the curve, that the average number of cases remains flat over an extended period of time. And this again is just, it's a little wonky, but these are simply the new cases per day with a 7-day moving average. So that's really all I have today, is really just kind of showing you how our dashboard is really going to be a critical point as we start to think about recovery and moving towards phase 2. Really wanted to highlight some of the metrics that we are displaying there and how important they're going to be, how we're continuously monitoring it in order to do that. But in the meantime, please stay safe, stay home, continue to wear your face covering, continue to practice that social distancing, and continue to practice good hygiene. Thank you.
Thank you, Trudy, very much. We appreciate the amount of effort public health has been put into our testing. And as the governor announced, the phase 1 was to worry about the number of tests we had to do, percentage to our population, to make sure that we had the capability of bed space and overflow capability for our patients, as well as that we have sufficient supplies of PPE to continue on this battle as we go forward. And those are all points that San Bernardino is really striving to hit. And I think with the efforts that public health has been doing with the additional testing, we're really doing like more tests this week. I think we did the previous 3 weeks together. So we will see those numbers rise, but it gives us better indication where this county is. And that's why it's important to have those metrics of the percentages so we can understand what that means. As we do more volume, we'll see our top number go up, but is that the correct number of percentage compared to how many people are sick in the county? But to explain on the hospital side and how prepared we are there to take care of our residents, we have Dr. Borger and Dr. Pendleton to explain how we're doing at ARMC. Come on up.
Thank you, Supervisor Hagman. So, we talked a lot about testing, and one of the types of testing that we're moving to is called serology or antibody testing. I'm pleased to announce that we started antibody testing this week through the drive-through testing center at Arrowhead Regional Medical Center, and Public Health will be adding that to their clinics soon. The antibody testing is different than the kind of testing that traditionally has been talked about. That kind of testing just tells if you actively have the virus at that time or not. The antibody testing is a reflection whether you've ever had the virus and what duration ago that you had it. What I want to explain to the public is that just because you have a positive antibody test, that does not mean that you are immune or you can't get it again. That is still to be determined. We don't know that answer. It's very important that people understand that this test does not mean you're immune, that you don't have to social distance, and you don't have to wear face coverings. So this will give us a very good snapshot as far as how many people have been exposed in the community, and we're going to use it for that purpose currently. So I'm going to switch gears a little bit and talk about what's happening in our hospitals in the county. The reflection of the number of patients hospitalized is even more important than the number of patients testing positive. The number of patients hospitalized is a fixed percentage of the number of people that are getting COVID in the community. We're following very carefully on a daily basis the number of patients that are in our hospitals that have COVID. And as you can see from this graph, it is extremely flat. The dark lines on the bottom are the average number of COVID patients in the hospital, and it is extremely flat going back to early in the month. What this means is that we still have COVID out there in the community. It's still spreading. It's not spreading faster than it was a few weeks ago, but it's not spreading that much slower either. We also follow the number of ICU patients with COVID in the community, and that also shows a fairly flat graph on the bottom. Ventilators have been something that has been quite a bit discussed in the news, and we are following our ventilator capacity in this county. And the number of patients with COVID that are on a ventilator has also been flat, and we have ample supply of ventilators ready should things become worse. So this is a slide that shows the hospitalizations on a rolling 3-day average. And you can see that there's a slight improvement in hospitalizations, but for the most part, it is very slight, and it is very constant and very flat. This is a graph of projections, and you can see that we've been beating projections, and we have ample surge capacity in our hospital system. This is the projected ICU need, and as you can see, we've flattened the curve, and our ICU capacity is ample, and we're at the ready, but we still have a considerable number of patients in the intensive care unit. So as we transition from the approach we've had, we found it very important to have a more targeted approach to the sensitive and vulnerable populations. COVID has not affected people evenly throughout age groups. It is especially hard on the older population, and the most vulnerable populations that we've had have been in the nursing homes. So we developed what we call the SOS team, which is Skilled Nursing Facility Outreach and Support Team. We currently have 4 teams. We're moving to 5 teams on Monday, and we're going out and proactively visiting some of our skilled nursing facilities to make sure they have enough PPE, to make sure their hygiene is meeting the standards, and to make sure that the patients are protected in the skilled nursing facilities. This is an ongoing project, and we've currently visited about 50 skilled nursing facilities and plan to visit the rest of them by the end of next week. So I'd like to turn this over to Dr. Pennington.
Good morning, everyone, and thank you, Dr. Borger. One of the first things that I wanted to share with you this morning was I'm seeing something now in the last 2 weeks that I've not seen in 35 years in medicine. I started my career as a fireman paramedic, and that was about the first 15 years of my career. For the last 20 years, I've been working as an ER physician, and 17 of those have been at Arrowhead Regional Medical Center. People are afraid right now to call 911. People are afraid to come to the hospital. Remember, emergencies don't wait, and we really want to emphasize to each and every one of you that if you are experiencing signs and symptoms of a heart attack, you can see the gentleman here in the photograph gripping his chest. If you're having chest pain, pressure, heaviness, you're breaking out in a sweat, please do not be afraid to call 911. please come to the emergency department. There are amazing things that we can do for you, and we can decrease your chances of having a bad outcome if you come early. The second slide is a gentleman having a stroke. I know these are common presentations to the emergency department, but what we're trying to tell you is that in these individuals, if they're having signs and symptoms of these common medical problems, in stroke we see things like what? We see facial droop, arm weakness, slurring of speech. Time is critical. Time is tissue. If you don't come quickly, the damage that occurs may be permanent, and you may actually cause an increase in your health issues, and you may increase the length of hospital stay. So we really want to urge you, whether it's those signs and symptoms, whether you're having horrible abdominal pain, we're seeing people that are afraid, and they're showing up to the emergency department now after something bad has happened. They had appendicitis, but they waited too long, and now their appendix is ruptured. So what could have been a short stay in the hospital has now resulted in a 6-7 day stay in the hospital because they've developed an abscess. So we really want to encourage you to please don't be afraid to come to the emergency department. Don't be afraid to call 911. The paramedics are there for you. Your first responders are there. They may look a little different. They may, be in the same spacesuit that the rest of us are wearing. They may request that you meet them outside of the home if you're physically able to. Again, the crews are going to be wearing that personal protective equipment. If you call for an ambulance, they may share with you a mask so that you can wear one when you're in the back of the ambulance. But again, it's really important that you not be afraid to access the system. Hospitals are adjusting their workflows. We're working to reduce the spread of COVID-19 among our patient populations and staff, and we've done a lot of new things within the hospitals across the county. We're screening patients at the door. We are reducing hospital patient visitors. I know this may be inconvenient or feel uncomfortable. If a family is there and the parents are there with their children, we may ask that only one parent come in, but we are trying to decrease the number of possible exposures from within the hospital. We've redesigned the flow and movement through the hospital in the foot traffic, and we're creating separate waiting rooms and urgent care areas for COVID-19 suspected patients and our non-COVID-19 patients. We're also working very hard in the community at all of our hospitals to increase our telehealth services. It's really, really important that you keep up and make sure that you're taking care of yourself. If you allow yourself to get, during this time, run down, you're a diabetic and you're not filling your prescriptions, you have congestive heart failure or hypertension, it's going to increase your risk of coming down with COVID-19. So we want you to check in with your doctors or specialists. We want to really encourage you to visit the emergency room when necessary or call 911 if you absolutely need to. We wanted to highlight one of our team members. We're very proud of him. His name was Dr. Lewis Tran. This is actually a group of physicians that volunteered to help their fellow Americans. They actually all flew to New York together. Dr. Tran is one of ours from Arrowhead. He's a San Bernardino native, but Dr. Tran is wearing the black t-shirt. He's second from the bottom. But he flew with a group of mostly emergency room physicians to New York to help work in the pandemic. He actually is currently at Elmhurst Hospital. He's going to spend 2 weeks there. We just wanted to kind of give him a shout out and everybody that was a member of this team. This team, when they come back, is going to bring the lessons that they learned back to California, and they're going to spend some time in quarantine before they're back working in their home emergency departments, but they're going to share with us what they've learned. Another interesting little tidbit, Dr. Tran was working with a team of JPL engineers before he left. You see this little box that was what I'm calling an airway shield, but it's now popping up in emergency departments and ICUs throughout California. It was a group of people that came together. We had an idea of how can we better protect people? Many emergency physicians are doing something similar across the country, but it protects the patients and it protects the staff both from droplets. I wanted to take you through just a little bit of a historical perspective. I just wanted to show you one slide just to kind of bring home a couple of important points. The Spanish flu of 19 is definitely the worst pandemic in modern history. We suffered over 50 million deaths worldwide. And what was true in 1918 is also true today. The key then and the key now is the social or the physical distancing. I know it feels like an episode of Groundhog Day for everyone. Everybody's telling you to wear your mask and make sure that you are, maintaining your social or physical distancing, making sure that you're not, gathering together in large groups. But it's so very, very important. This was published in the Journal of the American Medical Association in 2007. And what I found interesting about this is that the same issues that we're dealing with today, they were dealing with in 1918. And if you look at the cities, not to call out a couple, but if you look at, Philadelphia or New Orleans, you see those cities that ordered social distancing measures later and for shorter periods tended to have spikes in deaths and higher overall death rates. And if you look at those cities that worked really hard, they ordered social distancing measures sooner, and they had it perhaps in place for a longer period, they were able to slow the infection, they were able to lower those overall death rates. And they actually found that death rates were around 50% lower in cities that implemented preventive measures early on. We have a lot more information today than we did in 1918. We're going to be able to kind of tell us when to either put our foot on the gas or kind of pump the brakes as we see what's happening in the community. So we're monitoring this data each and every day, but we want you to understand that, again, the key then and now is still social distancing. Some final thoughts. Emergencies don't wait. We want you to access the system. Our hospitals and our first responders are prepared. We have plenty of hospital capacity. Our hospitals are safe. We have a backup plan in place. We are working hard to form different alternate care sites that if our hospitals become full, that we have places to take care of people. And we have 3 sites that we're working on in the community. So please be smart, be safe, be good to each other, and remember, social distancing is key.
Thank you both. Our great doctors from Arrowhead doing great work every day for us on the front lines. I started out this press conference talking about what we are doing as a county moving forward. And I think that's what most of the residents and businesses are excited about and what we've been doing to prepare for phase 2 of the governor's plan with low-risk businesses especially. For the last week, our ED team have got together the Chairman's Coalition of Business Leaders and Public Health Officials to try and come up with a playbook, for lack of a better word, of how to open businesses in a safe manner. And we believe that will be wrapped up and presented to the board on Tuesday. We're also doing concurrent projects of a PSA or a public announcement type of system so we can educate those business owners that when they do open, they can open up healthy and practically for our residents to go use. And with that, we're going to be having a campaign for our businesses. We're calling the Kovach compliant business campaign that they put a sticker or place card in the window that the residents know that when you do go use the services of that business, that they have been educated and they've taken the steps necessary to keep them safe when they go shopping or for their services. So all those things are working concurrently at the same time. And we've had a number of meetings with the business leaders, and we're looking at best practices from different associations. And basically our message that will be going out to the governor on Tuesday is that San Bernardino is prepared to go to phase 2. And with our data that we're getting from our public health, our other facilities, that we would like to have a very tight timeline so we can start letting our economy back open up here in San Bernardino and be able to let our residents start to enjoy more recreational activities as we go forward. So we're looking forward to some of the new health orders coming out to maybe give us some more of those options, as well as prepare in our case to the governor that San Bernardino County is in that position to go forward. And I know there's a lot of anxiety out there. I hear it from my residents every day. They're very tired of staying at home. They're very much tired of hearing us preach to them about wearing the face coverings and staying their social distance. But those measures that they have been taking, they have been sacrificing so far to do, is the reason why we're in the position to go make that case to the governor going forward. And so we're going to keep working toward that different phases as we go forward, as well those low-risk businesses and our associations throughout the county, our partners with our cities that will be also administering this COVID-compliant business campaign that we'll be doing. And more importantly, I think, than any of this is that we're putting money behind it. We're going to help those businesses get reopened. We're taking up to $30 million of our COVID-19 dollars to be spent with small businesses to allow them to be able to reopen and do some of the pragmatic measures we need to have them do to protect our residents from spreading this disease even further. So we have those presentations coming up to the board for approval on Tuesday at our regular board agenda meeting. But meantime, the residents need to do the three basic things: wear your face covering, stay your physical distance away, and watch your hygiene, either through sanitation or washing your hands. We need to do that together. It's our job as the county to hopefully lay out the framework for this recovery and to be there when you need us. And we're all working on that together as a team effort in San Bernardino County, the local governments that we partner up with, as well as seeking guidance from the state of California as we go forward. We also have a food launch program that we're working with the senior citizens, that 65 and over, that qualify for a short period of time through federal funds that will work for our adult and aging services, that will allow them to get 3 meals delivered to their homes each day. There's a lot of conditions, but that information is on the website as well. So we encourage everyone to stay informed. We try to send as many updates as we can through our website and through other announcements through social media, as these things are changing quite rapidly. As programs come online, we want to make sure that if you qualify, you get the resources and assistance that you need, as well as information for our small businesses to be able to move forward in the coming weeks ahead. And with that, our JIC resource hotline is 387-3911. We want to make sure you have the ability to call in there for questions as well. And we'll open it up for questions from our audience. Yes, sir. It's been a lot of discussions with my local mayors and city council members. We're all feeling the pressure from our residents to do something and to be proactive and to start taking some of these things local control. My message to the residents and to those mayors, I just got off the phone with them, is we got to stick together. The most important thing we have right now is to make sure we recover in a way that doesn't get us back into a spike, and we do so in the proper way. I really hope that the governor sees that county by county we're different. We're different in the county of San Bernardino, from our valley area to the high desert. You know, people are spread out in different densities throughout our county alone, much less the state of California. So to have one size fit all for the state is very difficult. So we're hoping that he allows us to do the right thing, and we are allowed to put in those pragmatic measures to keep people safe here. But with that, you don't need to get rid of all the orders, and you don't need to have orders continue indefinitely. You can adjust your playbook as time goes on, as data comes into our hospitals and to our medical society. I'm not sure which one's better on this thing. Can you hear me on this one better? I don't know. Okay. So it is a day-by-day basis, but we believe the playbook we have for types of businesses that need to be flexible onto the city level for different environments will allow us to do that in a smart design way. And I see the frustration. I see the frustration from my other supervisors that I know throughout Southern California, as well as the city mayors. They're getting a lot of pressure to let's open this thing up. So that's what we're trying to do.
Can you give us some idea of what are some of the ideas that are being tossed around to present on Tuesday? Certain businesses that may be able to have some restrictions lightened. Is there any discussion of small gatherings, like families of 3 or 4 people less? Like right now, it's nothing. What are some of the things that are being discussed?
We've always been try to be very pragmatic here at the county. Obviously, you have a household of 7 people, you have 5 kids and a husband and wife. We see that 7 group of people being together because you're living together. So as far as the business practicality of things, there's a lot of things we've been seeing are essential businesses already. A lot of them put up the physical barrier between the checkout person and the customer with a little hole to put the money through. We've seen the X's on the ground going out. that has that active ingredient of physical separation or barrier separation that we're looking for. We see the businesses saying, wear your mask only going indoors. So that's another key component. Okay, we're also trying to look at how we integrate our touching things to not spread those germs. That's where hand sanitizer dispensers or things like that may come into play. But what we're looking at is a very pragmatic approach to our businesses opening up. And some of those businesses that we think are low risk, some of what the governor says, the office buildings, other retail establishments, those type of things that you can open up. How do we phase in our dining options? Right now, you can walk in and pick up something to go, but can we have it where the tables are spaced out 6 feet apart? I had an idea from one of my mayors this morning saying, hey, how about we put some of the tables 6 feet apart inside and open up part of the parking lot and keep them physical distance? So the basics that we're working on with public health is those very pragmatic measures that can be administered on a local basis that we can enforce. And that's why we have our COVID compliant campaign. Because myself as a consumer, or any of my residents, I want to have the assurance and the confidence if I go into a certain business that they have met those standards set by the county or by the state in this case, that will allow me to go in a less risk environment. So they have taken those steps as a business to do it. And that's why we're willing to put some of this recovery money behind it too, because that does require some financial investment into that business to make things happen. It's not going to cover 6 months of operational costs by any means, but hopefully it'll offset some of those initial costs to get the hand sanitizer up, to put the plexiglass up so we can have that safe barrier between the customer and the receiver, to make sure that their staff have the education to make sure they're washing and disinfecting their table and chairs if there happens to be a table or chair, and the people behind the scenes are wearing the proper PPE to make sure that they're not susceptible to the virus nor passing on if they happen to have it. So those are type of matrix that we'll have a first presentation to the board on Tuesday, but they're all very pragmatic, and there'll be a playbook. And as we're allowed to work with the state to open up certain sectors of our economy, we want to be prepared to do so, and that's why our message to him is that we will be.
Question, thank you. I don't know if you want to weigh in on this. This is probably more for one of the doctors, but there was that widely circulated YouTube video of the two Kern County doctors saying this is just like the flu. We've been hearing this for a couple of months. That video was even shared by some prominent San Bernardino County employees. So what's the message about this thing?
Well, either Dr. Kump or Trudy to come but talk about the actual numbers, but I think we saw on that slide presented earlier that this is more like the pandemic of 1918 Spanish flu or something, where it is very much more contagious than the normal flu, and those effects on patients that have pre-existing conditions are devastating. And so I think that's really what it is. But we are learning and we are socializing differently, and I think that may go forward. This physical distance, they're shaking hands, washing their hands, they're not touching everything, things that my mom used to tell me to do all the time that I probably got very sloppy not to do over the years. They're reinforced in my head now that I wash several times, an hour almost, and I'm watching what we do. So that awareness should be good for us to learn for all regular flus, much less COVID-19. But I'll let Dr. Borges talk a little more on the specifics.
This is just the flu as they push for stuff to be reopened. Can you step all the way to that? I don't know.
Sure. Yeah, I did see part of that video, and this is not just like the regular flu. I've lived through and worked through many really bad flu years, and never have we seen young, healthy people get severely critically ill for no reason and get put on a ventilator, and some of them die. That does happen occasionally with the flu season, but not in these numbers at all. You look at New York, you look at the media every day, and you see prominent people with very few medical problems succumbing to this disease. This is not like the regular flu. In saying that, we need to treat it like an infectious disease very seriously and not minimize things. That's essentially my response to those physicians. Those physicians don't work in a hospital setting. They might not see the devastation that happens in young, healthy folks. They might not see the healthcare providers that are getting ill. So they might have a view that's a little bit different.
Much, but as far as Supervisor Hagman, you were talking about the meals that are going to be going to seniors. Is there someone who can speak more about that, how that's going to work, what's being done to make sure everyone's safe, what's being done to get those much needed resources to people who need it?
Yeah, probably Leonard knows more about the details. I do know the criteria. It's through May 10th or 15th? May 10th. You want to come up and talk about the details? It's for seniors over 65 that's been exposed to COVID or potentially in the COVID, 600% or less in poverty and not receiving any public assistance. Department of Aging and Adult Services is going to be handling those calls and coordination and be working with local restaurants to provide those meals in home delivery. But Cassandra, my expert on this.
Yes, good morning. Cassandra Thomas, Assistant Executive Officer for Human Services. This week, we're happy to announce that we are participating in the emergency feeding program that is authorized by the California Office of Emergency Services through the California Governor's Office and in support of FEMA. This allows us for a short period to provide 3 meals a day for individuals 65 or older with underlying health conditions. Actually, Supervisor, you did very good in describing the program as we know it today. It requires a registration process. So we have a general number that is available currently on our website, which allows us to receive inquiries from individuals to learn more about the program. So there are certain criteria that we have to collect to ensure that individual is eligible for the project. And so there is one number that is for registration, and then there's another contact either through email or phone number for restaurants that would like to participate in the program.
How necessary is that program?
Extremely. Prior to us receiving the information regarding the program last Friday, the Department of Aging and Adult Services are already providing thousands of meals to seniors throughout the county of San Bernardino. So with this added resource, we actually are able to complement much needed resources to existing services that we were providing through our other mandated responsibilities.
David Ward, our Public Information Officer, do you have anything online that you want to bring up for questions, or I'm not sure what else we have. Did you have any more either?
I had one for Trudy, if you had some. You were looking at, I think so far the number of people tested, a little over 10% positive. Ideally, we're going to get to that point where we have a good random sample of the whole population. I don't think we're anywhere near that yet. Maybe I'm mistaken. What would you guess of all the people we've tested? How many, what percentage would you assume or think, or you may not even have this number, are truly random people with no symptoms, just, hey, I'm now driving up and presenting myself because I want to be tested?
So is the question what the infection rate we think is in the county of folks that maybe just be asymptomatic and kind of part of the general population?
Tested, how many did not fit any of the criteria that we first had, that you had to have symptoms, maybe you have potential exposure, et cetera? Like, what percentage of people who are now being tested do you think are truly random?
Well, and because in San Bernardino County, we do still have criteria set up for all of our testing now. As of, I'm trying to think, I think we're opening it up either next week. We're actually continuing to expand the criteria. So we right now require that you either have one of 3 symptoms. We're expanding that symptom list to also include headaches and some other minor symptoms that we have seen as a result of COVID. And there's almost, I think, around 10 symptoms that you can have. Now, we've also opened it up so that if you are a healthcare worker, somebody working in public safety, an EMS first responder, or anybody working in a congregate setting, you can come symptom-free. So, correct, we're still not. But part of my plan is to ultimately do that as we continue to expand out testing, ensuring that we've got sufficient supply chain. That is my ultimate goal, is to extend it out to the general population.
Well, I want to thank you for joining us today, and please keep informed for our website for more additional information. We'll look forward to having another conference next Friday.
The County of San Bernardino is here to serve you during COVID-19. Go to sbcovid19.com to find important resources during this crisis. Find a testing location near you. Learn the latest on what businesses are closed or reopening. Find food assistance. Get foreclosure and evictions help. Connect with business recovery assistance. Or sign up for a daily email update. Let's work together to keep us all safe and healthy. Go to sbcovid19.com for more information.